free to, we will be presenting the recording of the session, hosting it on our website. So we will have a link for that. We will send to everybody. But we're going to go ahead and kick it off. So thank you so much for joining us today. I have muted everybody's lines. So if you do have any questions, feel free to jump into the chat, and I will be monitoring the chat throughout the session. But if our panelists, if our three panelists want to go ahead and open up your lines and introduce yourself, if we want to start with Andrew, that would be great.
Hi, everybody. I'm Andy Kripe. I'm a shareholder or a partner at the Polzinelli Law Firm. I'm the chair of our National Employment Counseling and Investigations practice. I've also taught over the years at Loyola's Law School on employment law, and I'm happy to be here with you all.
Thank you so much. Professor Varma?
Hi, everyone. Arut Varma. I'm a professor of human resources at Quinlan School of Business. Been here 24 years, and I'm excited to be here this afternoon and talk about this subject, and looking forward to your questions. Thank you much.
Thank you. And Julie?
Hi, everyone. Thanks for having me. I'm Julie Jacobs. I am a principal and founder of Ironstein Associates. We are a human resources consultancy for privately held and family businesses. And I am also affiliated with the Leadership Hub as a facilitator and coach.
Wonderful. Thank you so much. So we're going to go ahead and stay with you, Julie. And the way we've kind of broken this down is, what are some of the HR foundations, or how do we set the table really for reopening? And so, you know, Julie, my question for you is, what is a fair and equitable callback to work process for workforces, or what should be people thinking about? And how do you communicate all of that information with your team upon their arrival back in the workforce?
Okay, thanks. I think that what is fair and equitable overall culturally, we can all agree on. What we need to do in terms of communication will probably depend on your organization. So I think that what is most important to recognize is that it's possible that a lot of our organizations are not going to need the same type of personnel that they needed in January. They're going to need to be able to get them through in third and fourth quarter. I was with a large group yesterday, and they talked about they're finding areas in which maybe roles are no longer going to be necessary, be it technology or the way that their industry is going. So I think you have to keep that in mind when you start developing your approach for calling people back. So one of the things that we do is suggest that you start looking at almost in academia, a rubric in which we're looking at the criterion that is going to capture you coming back and making sure that you're creating a sustainable future for your company. That every company has a little bit of a nuance based on what you do, but what you're really looking at is, does this person have the skill set that we need for the future and what our organization is going to look like? Is this individual a good cultural fit? Are they an individual that is going to be able to collaborate and continue to excel in what could be really chaotic times? Another component is the very essence of, if we're still struggling to financially stay afloat, looking at those individuals that are very versatile in terms of skill set and have the ability to possibly pitch in and do other things. So I would suggest that you get outside your C-suite and you look and talk with your managers or directors, or however your org chart looks, and you really think about what criterion is the most important thing that should be weighted so that you come out okay on the other side. We're in this together, but we want to make sure that we're leaving a sustainable company. And then I think that how do you communicate with your team is probably the second part of every question that we have right now. How do we communicate to our team? How do we do it? I would say transparently. And in this particular case, I think it's important for executives and higher level individuals to recognize you're probably not the right person to decide who possesses the skills, or at least not alone. Get down into the director level and with those managers and talk about what they should be evaluating and what they see, because quite honestly, they're in the trenches with these people day to day. So how I would communicate is by including them and engaging them in the process.
Perfect. Thank you very much. And so, Andrew, what action, plan should people follow if they already know that somebody has been exposed? How do people approach this discussion? You're the HR lawyer, so we want to go directly to the source here to find out, how do you think people should start having these discussions?
Yeah, it's a good question. So I've been dealing with this across the country since early on in the pandemic. A lot of my clients are critical infrastructure businesses that had no choice. They had to continue operating, whether it's contractors in the national defense area, large delivery companies, all of those kinds of companies. And so seeing a lot of things happen over the last couple months and some lessons learned. First, I'll give you a general rule. When it comes to what you should do in terms of disclosure to other employees after an exposure, the simple rule that you should remember is, think about it like informed consent. You want to give your employees enough information that they can make an informed decision about how to protect themselves and their families. And that's critically important. When there's an exposure in the workplace, it's not just your employee that's exposed. If they go home and they live with people who are at a higher risk, and now there's even a concern about children, that work exposure goes home with them. So this informed consent concept is really, really important. You need to give them enough information to make an informed decision. What you have to balance against that, and there's a way to do that that I'll briefly touch on, is the privacy right of the person who has the infection. And you have to, under the Americans with Disabilities Act, you're not allowed to disclose somebody's medical information. So how does that work? Early on, what employers were doing is they were sending very general notices to all employees saying, hey, this is to let you know we had an employee who was infected. They worked on this floor. We can't tell you their name, and, and good luck. And, I don't mean to say that critically. I was actually working with clients. That's the best you can do if you don't plan in advance for how you're going to deal with it. It lets people know they're potentially exposed, but frankly, it creates a lot of fear because people have no idea what the nature of their contact or exposure is. And so based on those early lessons learned, the biggest thing that we've realized is you have to track contacts before anyone is sick. If you don't do that, you are not going to be able to give people effective information. And you're going to be left with very poor choices in terms of contact tracing within the workplace. So it's a basic concept that I like to call advanced contact tracing, which is have employees identify their work circle or their circle of contact. These are the people that they need to work with on a day-to-day basis. Try to keep them limited to that. If they have contacts outside of that, those contacts should be calendared daily, just literally in your calendar. That says, hey, I came into contact with this person. I was within 6 feet for more than 15 minutes, which by the way is the CDC definition of a close contact. There was sneezing or there was coughing. Record that information so that each person has it available. So if there is an exposure, you as an employer will be ready and able to quickly pull together the contacts, identify who those people are, and actually understand the nature of the contact. And when our public health authorities catch up with their contact tracing staff, which right now is in short supply, they will be able to get that information quickly, quarantine the people who have been exposed, and you can stop the spread in the workplace. If you only address the person who's symptomatic and who's been diagnosed as ill, you won't stop the spread. So you have to be armed with that information ahead of time, and you have to plan ahead. If you haven't, you got to deal with that reality, which is unfortunately those letters, which really scares people more than helps them.
Thank you very much for the insight. Now, as we are moving on a little bit, we at the university have been doing a wide response. And so I want to pass this off to Professor Varma to talk a little bit about what research have you or any of your colleagues done in connection with COVID-19?
Thank you, Colleen. As a matter of fact, there's a lot of research, as you might imagine, going on around the world, trying to figure out how companies are responding and planning to respond. And the second part is the more important, planning to respond, because everybody says, we don't know what's going to happen. We're not out of it yet. But to give you a couple of examples, one of the biggest software companies based out of Bangalore, India, it's called Infosys, and they're all over the world doing back office work. They basically decided that to the extent possible, they're going to let people continue to work from home. Those that have successfully done this will continue to work from home for the foreseeable future, which is several years. So they're going to shift their model. They're not very clear on how they can bring everybody back. So they are they're going to start allowing people to continue to work from home. And other companies, for example, IBM, you might have seen the CEO has come out with a statement of how to deal with people who are working from home, understanding the needs they may have. And he's laid out several principles, which I just want to share real fast. Number one, pledge to be family sensitive. So recognizing that even though you're in an office meeting, a child might walk by or somebody might need the person at that moment. Pledge to be flexible. Sometimes people might just need to have a break. I pledge to be kind to everybody. So, we'll need to set boundaries. So companies are seriously rethinking how they can bring people back. And one more thing, and then I can come back later, I'll hand it back to Colleen, which is at least in the immediate future, when people do come back, many of them will be very nervous, having gone through a loss of a sense of control. People will be short-tempered. People will not be able to behave the way they used to, with the high fives and the back slaps and the hugs. So that's going to change, and people are not ready, we don't think, to handle this, because we don't know how to handle this. So everybody's going to have to be a little more patient, a little more considerate. And companies are trying to figure out how to handle this, how to train their managers. I'm going to stop here, hand this back to Colleen, and then come back later.
Thank you. And Andrew and Julie and Professor Varma, just to let you know, a couple of questions have popped into the chat. So if you see any that you'd like to respond to, feel free to do so as we're going along. Actually, I'm going to stay with you, Professor Varma. You know, from an HR perspective, what have you seen as some of the global impacts, either you've seen here domestically or abroad, on the workforce right now?
Sure. This has actually had, unfortunately, a huge impact on the informal sector around the globe. So in many countries around the globe, there is an informal sector, as here, where people work literally on a day-to-day paycheck or cash basis. And that, if you look at tourism, if you look at hospitality, these industries have been severely impacted. And some of them may not come back. And even if they do come back, it may not be in the same shape or form. So there will be permanent shifts. And as far as the employees are concerned, not for the better, because contract work will not work anymore the way it used to. Because there's a lot more background and tracing that we need to do now. So we need people to be employees rather than just contract workers, because now we are concerned and responsible for everybody else. So that's one big shift that we are seeing across the globe. Another big issue is the issue of inequity that has shown up in everywhere. I was in another session yesterday, and somebody brought up the fact that there was a news piece a couple of days ago that the CEO of AT&T is retiring, and he's going to make $274,000 a month for the rest of his life. That's his retirement package. which is fine. It's well earned, if you will. But people are not happy. People who are making $8, $10, $7, $15, $20 an hour have lost their jobs, their livelihood may not come back. So the inequities that we have in the system are going to become much more stark. And then the reaction to that will also start to show up. So some jobs will never come back. Technology will take on a much bigger role now. We've been talking about artificial intelligence for a long time. Is going to step up because they do have availability of technology around the globe to do various things. We've seen robots in the manufacturing for a long time. We now have robots in teaching in schools. We have robots doing restaurant work. That kind of work will definitely be taken over to a large extent by technology. So some jobs will essentially vanish, and that means that governments and countries have to worry about employment and unemployment. I'll stop there, hand back to Colleen, and then come back.
Thank you. Julie or Andrew, do you want to add in on anything about the global impact that you've seen at all from any of your clients or any of the companies that you're working with?
Sure. You know, the global issue is an interesting one. Most of my clients are global, and a few things that they're have encountered as a result of this. The first is this pandemic is sort of like a rolling wave around the stadium, and it's having different effects at different times around their operations. And one of the lessons I think that's taught everybody is the importance of really continuity planning and contingency planning, and having an increased level of flexibility. This isn't just a global issue. You can apply this locally when you think about people that have particular skill sets. This need for enhanced flexibility is absolutely critical. So having an entire accounting operation located in one particular area with no redundancy has finally been recognized as a major problem as a result of this. In terms of, you know, another thing just to kind of think about in terms of the global focus, one thing we've been seeing is that the approach to the pandemic is largely consistent across the globe, with some exceptions in terms of how countries are handling it. Sweden being sort of an exception to how a lot of other countries are handling it. But that has led to a sort of consistency globally for how employers are handling it. The core principle, I would say, is this, and I think it might get to one of the questions that's popped up, which is any work that can be done remotely should be done remotely until the pandemic is over. One of the questions I see is how should you handle that if people have been working effectively from home? And as you start to see orders allowing people to return to work in different states in the US or different regions across the world, there's kind of an immediate desire among some to say, hey, okay, everybody get back to work. The thing to realize, and this is important from a legal standpoint in the US, the CDC is still recommending that you do whatever you can to enhance social distancing efforts in the workplace. And that means keeping the workplace as thinly populated as possible. So as an employer, you have sort of a burden of proof, and that is if you're bringing people back and they've been working effectively from home, you have to answer the question, why are you doing that? Just because it feels better, or you like it, or you like seeing people in the office space that you're paying a lot of money for, probably is not compelling enough given that safety concern. And I think while the pandemic is going on, that's a mindset we should all kind of be very aware of, that whatever the discussion has been in the past about work from home versus being in the office is different now, because there is a legitimate safety consideration behind having as many people work remotely as possible.
I think if I could add on to that, Colleen, I agree with Andrew wholeheartedly in making sure that you're thinking through why you would want someone to come to work. If it's just something that you feel like, I'm paying for the space, I've got a huge lease, we should use it. I think that there is something to be considered. I am also acutely aware, just from my work, that we are social beings and that there's a reality to some of the individuals in our world, as well as Dr. Varma had talked about, who are possibly our hourly employees, et cetera, where the challenge on mental health from working from home is real. And so if you're tracking domestic violence, if you are tracking the calls actually to our employee assistant programs like EAP, I was on the Blue Cross Blue Shield briefing, and they have 100% more calls to their EAP in the past 4 weeks than they did the first 4 weeks. And so I think that as an employer, one of the things that we're suggesting that you do is to ask each of your employees whether or not they're more comfortable at home, or if they have a compelling reason why they feel like they need to go to work. And looking at that and then trying to assess with your population, can those individuals that feel like they may be healthier at work in terms of their mental health or output, what does that look like in terms of total population? And can we create an environment in which we meet the needs or the preferences of both?
Perfect. Thank you so much for your feedback, both of you. So looking ahead now, you know, we're trying to analyze what is this going to look like when we do return back into the office. So my first question is for Andrew. You know, what have you seen some strategies or methods that companies have been either testing or trying to do to reopen? You know, you and I had a pre-conversation about this, and I thought some of your feedback was pretty great. So I'd love for you to share.
Sure. So an overall principle in any strategy has to revolve around engaging employees in a positive way. And this is a unique opportunity to do this. The COVID crisis is probably the first time where we can really see that our own health and safety is in someone else's hands. And I'll give you an easy example of that. The mask. The mask is not designed to protect the wearer. It's designed to protect other people from the wearer. So if someone isn't wearing a mask when you're wearing a mask, you know, their safety, your safety is in someone else's hands. So take that concept, but work with it in a positive way and set a tone that, hey, we're going to work together to three components that then when you kind of take that approach that you can focus on. And I call them detect, protect, and act. The detect component is engaging employees to help detect whether or not they are sick. And that's daily symptom screening, temperature checks, and it may involve testing. We can talk a little bit more about that. There's a lot of issues there. The protect part are the simple things like social distancing, wearing a mask, and those sorts of things. And actually, I'm going to pause for a second. Everyone seems to have frozen. Am I coming through okay?
Yes, you're fine.
Okay. I just wanted to check. Sometimes you don't know. So that's the protect component, and then the act component is that concept of advanced contact tracing, and that's where you're asking people to proactively every day monitor their contacts. And one of the questions I saw scroll by was, is there a simple way you can do it? There's been a lot of talk about technological solutions, and I could go into the weeds on that, but the simplest and probably the most reliable way of doing this is simply to have people use their mobile device on a daily basis to set a reminder. At the end of the day, I'm going to list the people outside of my contact circle that I came into contact with right in the calendar on my phone, so that they have it and they have meaningful information that if a contact tracer came along later, they'd be able to tap into. These three ideas, though, detect, protect, and act, they all have to kind of work together. No one thing is going to protect the workplace for anybody. You have to, it's kind of like an all of the above strategy that really does depend on the efforts of everybody. And so it's a unique challenge, but it's a unique opportunity too, to rally people together in a positive way. And so what I'll say is the clients and the strategies I've seen that have been most effective have really tapped into that and really, really hardcore gone after it. There's no one size fits all. I can tell you, I've got clients approaching these things in a whole bunch of different ways. Some are using the daily temperature screens when people come in, and the guns, the gun thermometers. Some clients are switching to the infrared cameras to do that same sort of thing over the course of the day. Some are using the contact tracing and an advanced concept in a unique way that I would not recommend everybody do, but is possible depending on the setting you're in, where literally people have different colored t-shirts so that they know, hey, I'm okay to interact with these people and not these people. It sounds like a sociological experiment that could go horribly wrong. But these are unique times. If you have the right culture, if you have the right atmosphere, that could work. So again, it's the combination of things and putting that health and safety first. Last thing I'll say, this is a legal consideration. OSHA, Occupational Health Safety Act, right? It's something like nobody ever thought about really before outside of like heavy industry. It applies to the workplace, and OSHA, while they've offered very slim guidance so far, they've made very clear that OSHA does apply to COVID-19. And that means that an employer has to take reasonable steps to protect the workplace, to protect employees from that hazard, COVID, which does exist in the workplace. And so that's why all of these things working together are important from a legal standpoint as well as just employee morale. And I think, I've heard it from a few people now, this idea of, the impact on the psychological aspect of employees. People have to feel like there's something they can do. And the good news is there's a whole bunch of things they can do and that they're needed to do.
Perfect, thank you. Dr. Varma or Julie, do you have anything to weigh in on that as well?
No, I think it's really interesting to listen to Andrew because, well, obviously he has a legal perspective, but we also you have these varying groups of clients. And I liked his, I'll piggyback on his OSHA piece. What we've been doing is asking people to create a cross-functional team of volunteers so that those that have the most fear can feel like they're part of the solution. And when we do that, we try to make sure that we have people organizationally top to bottom. If we don't have our leaders demonstrating the right behaviors and actions, if we have the owner come to an office without a mask, that positional authority immediately makes people feel unsafe, right? And so we're all in this together. And I think that that's a very apt thing to continue to say within organizational structures. So the workplace changes that you're hearing about and that Andrew talked about in terms of OSHA, plexiglass, kitchens being emptied out, having lunches in different places, all of those things I think are imperative. And, there's the legal aspect of that and compliance. We focus a lot also on, in the HR piece, policy changes. If we want people to feel that we're behind them, then let's talk about unlimited sick leave till the end of the year so that you can make good decisions. Looking at work from home as a choice, for sure, and sometimes it wouldn't be. Also looking at core business hours and changing that so we don't all arrive at the same time, we don't all leave at the same time. And then the other thing that I'm working with a lot of clients on is a real travel plan that protects the entity. If they have customers that are in states that are open, that are asking us to send somebody there, how do we meet the need of the customer so we remain viable and protect our sales team? And coming up with some really, I think, fairly innovative ways of giving them the opportunity to say, no, I'm not comfortable to get on a plane yet, or telling the customer we will have one representative, but the other 6 are going to be zoomed in. So we're really trying to put some policies in place that support the well-being of both the individuals and the organization.
That's great. Dr. Varma?
I wanted to add a couple of things here in terms of strategies and methods that companies are using to reopen. One thing that I heard in one of the other webinars I was participating with is that we cannot think of employees work from home, work from the office just in terms of the type of work. That has to be crossed with willingness to work from home or willingness to not work from home. And this is going to be a tricky one, but just because somebody has a job that we believe lends itself to working from home, you can say, well, you're in this category, you need to work from home. Can't do that, because some may have situations where they don't want to. And the reverse is also true, that we say, you need to come in, but somebody doesn't want to come in or doesn't feel comfortable, not yet, because there's this big talk about the second wave and the third wave. So what do we do now? The job might require them to come in, but they are scared, genuinely. So this is something we have to start thinking about. And two more comments on this real fast. Andrew talked about culture. This is going to become very important now. From Julie's comment about the leader wearing the mask to sort of model the behavior, the famous quote we've heard over the years saying, culture eats strategy for breakfast. Well, culture is now going to start eating company profits for lunch and dinner if we don't actually change the culture. And it's not going to happen overnight. It's going to be a gradual process, but it's going to become very, very important. The last comment I want to make about this is, and Julie mentioned this, I sort of want to piggyback and reinforce that, is that ask employees. Because every time we bring this up in HR, because I've got 8,000 people, I can't ask them. Well, then you have 7,999 too many. If I haven't figured out a system to ask every single person in my company an important question, I've got a problem, and now more so, much more so. So we have to ask people. We have to have those conversations that we've often avoided, and it's going to be much, much more important. I'll stop here.
Thank you so much. That's great feedback. So my final question for you all is for Julie. Talking about some laid off or furloughed employees, what are some thoughts or some, strategies that you're talking about with corporations about how do you bring back that group of individuals and when?
Okay, so that is a huge question. And I would start by asking and saying, again, piggybacking on Andrew, I don't know if your union is represented. I don't know exactly whether or not you feel as if you're an organization that is trying to survive, or if you feel like after the PPP and you're coming through this, that this is financially investment that you're willing to make. So if you take the financial perspective, which is a huge one, off the table, I think that what you go back to again is how do you bring them back, and when there's meaningful work to do, and how you do it is again going back in and talking with your leadership team around where is the work and what is the skill set and the behaviors and the attitudes and the individuals that's values match that will help us come out on this on the other side. I was working with the executive team today, and we identified that our service area is going to be the first to come back, and they are going to be 100% inundated before other areas of the organization are. And so looking at the individuals that have been furloughed and trying to determine who may have that skill set and who may have that interest in coming back. I think as employers, we have to get comfortable having uncomfortable conversations so we can make the right decision. But in those scenarios, we are building a rubric of about 4 key metrics that we're going to use to try to make sure that we're bringing back individuals that meet the organization's needs in a fair manner. And as in all reductions of forces, as you decide how you're going to bring people back, you have to make sure there's no disparate impact on those that you're choosing to bring back versus those that you leave behind. So those are the things that we're looking at. I think it's really important to understand that I doubt on the other side of this that every organization is going to think that they need the exact roles that they had before going forward. So how do we take really strong cultural fit employees who are devoted to and engage them with the concept of coming back, but in a role that isn't what they left?
Sounds good. And so what I want to do now is I am going to pop up the chat. If our panelists want to do the same and pop up the chat, there has been some great conversations happening throughout the chat. Andrew, I know you answered a few of the questions, which is great. But we have a few questions around, I'm sorry, I'm scrolling back. You know, about contact tracing, which we've talked about in length. Andrew, I love your tip about, popping up your cell phone and making a little log for yourself of like who you, were in contact that week. That's great. Somebody else mentioned that they do the same for Google Timelines, which is another great resource. We
I
talked
can
about—
grab one for you.
Yeah.
Oh,
please.
I'm sorry. If
No.
you're wanting to take a moment to categorize, I see something around the EAP and
Yep.
whether or not
you.
that breakdown was home versus essential workers. I don't know. They did not break it down for us. But what I can share is that I was on the line with two other counselors, and we did a survey with an organization that we're working with through, well, it's a family business. And one of the things that we learned when we had a open format, which I felt was insightful and humbling at the same time, is we had an individual that came forth and said that mentally how hard this is on their whole family. They have 2 laptops for 4 workers currently and 2 students at home. They're in a school district that didn't provide iPads or laptops, and they take turns. And so for them, the stress of trying to perform at the highest level and then take turns and moving it out. And they're in an 800 square foot apartment for 4 of them. And so they're working out of their bedroom and they shift. And I think that goes back to a lot of the hard decisions you have to make in terms of when to bring people back and what people need and why you need to talk to people. So the EAP did not only focus on essential workers, I will tell you that, but I don't know the exact breakdown.
Thank you.
Sure.
Andrew, there's a couple questions.
Hey, Colleen, if you want.
Go ahead.
Yeah, about the contact tracing.
Yeah.
Yeah, so I'll just touch on a couple things. Couple comments about using Google Timeline. I agree. I think that's a great idea. I've been actually suggesting people go in Maps, which will track where you're going. If you're using an iPhone, make sure that you have location services enabled for that app. This is data that you control, and it'll allow you to remember where you've been. So it's helpful from that perspective. One of the questions is, could it get tedious, and kind of, I think, getting to the question of what is a contact for purposes of contact tracing. And I actually did a video on this. It's about 4 minutes long. It's on YouTube. It's not publicly searchable, but maybe I can send people a link. But we just need to track close contacts. And that's people that you've come within 6 feet of for 15 minutes or more, or where they've coughed or sneezed on you, something unfortunate like that, or you're sharing frequently touched surfaces like keyboards. You're looking for those close contacts, not anybody that you've kind of seen or been within a distance of. Now look, there's a lot they don't know in terms of how this thing spreads, and could you be infected by someone 30 feet away? It's certainly a possibility, but the emphasis for contact tracing is on these close contacts. So, the checkout at the store where someone's behind plexiglass, no, you don't need to track that. It would be nice to have it in your Google timeline, just so you're aware of where you've been. But you're trying to avoid those and minimize those close contacts. There was a question about technological solutions, and I've spent some time, and actually some of my clients are involved in developing some of those. And here's what I'll say. The technological solutions, there's a variety of approaches. The one that probably gets the most discussion, that's being used in Singapore, and Apple and Google are working on developing it. And it uses the Bluetooth beaconing in everybody's phone. And basically it registers a ping every time 2 devices get within what is estimated to be a 6 feet distance. That could be pretty helpful and useful. Couple of caveats and some big ones. One, it's not ready yet. Two, it may never be fully accepted or even accepted at a level in the United States where it's going to provide the answer. And three, just getting those pings doesn't give you the qualitative information that you actually need to have an effective contact tracing investigation. That's why we're recommending the calendar approach, which is not in lieu of, it could be in addition to those other things, but at the end of the day, you need the qualitative information about the contact. You want to know, did somebody sneeze or cough? And that's not going to show up in Bluetooth tracking. So in terms of the privacy aspect, the basic approach I've suggested is one that you could require people to do, but remember, they control the information. It's in their own device. So you don't actually have to get it from them until until you need it. So if they have symptoms, then you could ask them, okay, send me your list. And so that can help address the privacy issues. And those privacy issues shouldn't be underestimated how important they are. If people are afraid that you're surveilling them, they might not keep the information. At the end of the day, we want the information to be kept in a way that people are comfortable keeping it.
Thank you very much. One of the questions that just came directly to me, but Professor Verma, I think you might be able to answer this one, or at least give some guidance, I'll say. With most companies having hiring freezes or raise freezes, what do we do as employees who have been asked to take on extra work due to merging of positions? Any guidance you'd like to give?
Yeah, this is a question that has actually started to come up in several different areas, and it's a tricky one because obviously under normal circumstances, if I'm asked to take on more work, I expect some kind of compensation, additional compensation. But given what we are going through for the next however long, maybe a few years, I think it is expected now of all of us to be a little more flexible. So what the organizations need to do, and then I'll come to what employees can do, is to communicate transparently, very clearly, that we are not going to be able to bring back everyone. So those that are coming back, we expect and require and respectfully beg, if you will, to help us out by taking on these additional responsibilities. From an employee perspective, employees need to learn and recognize and accept that this is going to be required for at least in the short term. I am not going to be able to say, oh, I'm not going to teach an extra course as a faculty member, because that may happen. All of us may have to take on extra work. It's just what's going on. So it's a communication thing from the company's point of view, and from an employee perspective, everybody has to be ready to do additional work, do certain things, and people will be, for the most part, if it is communicated clearly as to why, and the work should be reasonable. So if I'm asked to teach a course in calculus, well, that's not going to happen. I don't care how much or how serious the need is, it's not going to happen. But a course in finance, I've done that, even though my background is not in finance. So employees have to be ready. This is going to happen, and it's perfectly fine. Company has to provide the training, and the communication has to be absolutely clear. Thank you.
Right. Thank you very much. I appreciate that. Well, I just want to say a big thank you to all of our panelists for joining us today. I really feel it was a very rich conversation. We will be saving the chat questions as well. So if you do have any additional questions, we'll be happy to address them with the panelists. But I just wanted to say on behalf of the Risk Management Center at the university, thank you so much for your time. If you do have any additional questions about what other services we provide on behalf of Loyola, feel free to reach out to our Executive Director, John Caltagirone. His email address is listed here as well, to learn more about the different COVID-19 responses that we've been having out of the hub and what other resources we can provide to you and your organization during this time. But I just want to say thank you again to our panelists, and we wish everybody well and happy health. Thank you so much.
Thank you.
Thank you.